on this webinar where today we're going to be talking about the back. Now, as you can see, I term the back our hub. It's our central point. It contains our spinal cord, which essentially controls all of our movement throughout the body. So it's clear why the back is so important. But before we dive into the content and why I think this webinar is so important is that it's predicted that back pain affects over 80% of people. So it affects a huge amount of people, and I actually think that it's probably even higher than that. So I think maintaining our back health is very important for everybody, and it's understandably, when you hear statistics like this, why it's one of the most common things we see in clinic. So as we make our way through this webinar, what we're going to be talking about is, firstly, what is the back? Obviously, it's important for us to understand what is the back and what it consists of. And then some of the common conditions or issues that we see in clinic. So the sacroiliac joint is something we'll talk about. Discs, and I'm sure you're all familiar with this term, slip disc. So we're going to talk about that. Quadratus lumborum, again, that's a muscle surrounding the back that we're going to talk about, that we find a lot of dysfunction in. And this buzz term, core stability. What is core stability? Finally, we're also going to talk about the glutes as well. So the muscles that come and attach into the back, that I often term the big bullies that can be causing problem for the back. So firstly, what is the back? Well, the back consists of our spine, vertebrae, and our discs. As I said, it's our central hub, so it has our spinal cord that allows for all of our movements. And there's a large number of pathologies that can happen at the back due to its complexity. Now, again, people take degrees just understanding the back. The amount of level that we could go into of detail would be very large. But during this webinar, I want to keep things nice and sort of short, sharp and concise. But essentially what we want to understand about the back is that we have our spinal cord that is protected by vertebrae, the bones that make up little joints that protect the spinal cord, and in between each of those vertebrae we have what we call our discs, which we're going to come on and talk to about later. So we're going to discuss some of the common conditions we see. Now firstly, the sacroiliac joint. So what is the sacroiliac joint? Well, the sacroiliac joint, we have two of these. It's the joints where the spine almost clunks into place into our pelvis. So if we imagine we've got our pelvic bones here coming around, and then the spine just drops into that gap. And so we can see that here, that we've got here, and it forms a. Why is this important? Well, so it's predominantly held in place by the glute muscles, which is something I'm going to talk about. They hold this joint in place and give it its stability, but the joint needs to have a lot of stability and some movement. And as I say, this is where we often find a dysfunction happening in the clinic. So it's very common for this joint to almost become stuck or a lack of movement. Again, when we're testing people in the clinic, we often find a lack of movement at this joint, and that can really resonate itself in back pain, typically experienced as a sort of square pain across the lower back. So that's why the sacroiliac joint becomes a very important joint for us to be investigating. And when might we feel this? Well, typically, again, we hear this or feel this when somebody might be getting up from a seated position. So if we've been seated for a long period of time and then we go to get up, and we need that movement to happen at that sacroiliac joint, but if it's become stuck while we're in that seated position, that's why it can be very difficult to get up and into extension, and why that can be sore. So that would be a typical symptom that we would see for somebody with a sacroiliac joint issue. Okay, the discs. Now again, it's important to understand firstly, what are the discs? Well, the discs are, and we can see here that we have these kind of round structures. I often describe them as like donuts with jelly or jam in the middle of them. Sorry, it sounded very American there by using the term jelly, but yeah, we have these donuts. So we have the outer layer, then we have the inner fluid. Now what they do is they absorb our shock in the spine. So they sit in between these vertebrae in order to absorb shock. So, you know, they work very well, they're helpful for us. But what can happen is that they can bulge firstly, and we can have these bulging discs. So if we look here, we can see that occurring there, that actually the fluid is starting to push onto the outer layer. Now, why is that a problem? Well, from these spaces come all of our nerves coming out of the spinal cord. So it might be that we have a bulging disc that is completely non-symptomatic because it's not touching a nerve. But the problem happens where if the bulge then impacts upon the nerve, that then creates that pain. And so A condition we might be familiar with is something like sciatica, which is where the nerve comes out and the disc bulges and hits that sciatic nerve as it comes out. And so that's where we can start to get pins and needles, tingling, burning type sensations referring down the body. And in the case of the sciatic nerve, it runs down the leg. So when we have this term slip disc, it's not technically correct because the disc doesn't actually slip out of place. What happens is it bulges, and then we can also have a herniated disc where the disc actually breaks and the fluid comes out into that space and impacts upon the nerve. Because of this fluid, over time the discs do degenerate. They do become dehydrated. That's quite typical. And as I said, we've got this term slip disc, which we technically don't like the term because it's a bit misleading. We rather use the term bulging disc to think about. And as I mentioned, the pain can be felt in the case of sciatica as something to be running right the way down the leg. So even if you've got pins and needles, tingling, burning happening in the toes, the issue could be right the way up in the lower back where you've got this bulging disc. So now this is one of the important points as well. It's been typically felt that if we get these back problems, we require back surgery. Well, actually, we're finding that to be true less and less. We're not saying that surgery isn't required for some cases, but there's also a lot that we can do, even for disc issues, before we get to have to go down the surgical route. So the quadratus lumborum. Now, the quadratus lumborum is this squarish shaped muscle. So quadratus lumborum sounds fancy, but it effectively means square lower back. So we have this square lower back muscle that sits in here, and it's a very interesting muscle because you can see, yes, it runs from the top of the pelvis to our lowest rib, but also it has these attachment points onto the lumbar vertebrae. So if we get dysfunction in these muscle, what then typically happens is that it's very common to then relate into lower back pain. So what the muscle does, well, it helps us when the two muscles, because we have one on either side, when they work together, it flexes our spine, and when they work on their own, it moves us off to the side. So again, if we're finding that as we tip off to the side, we feel a restriction in the opposite side. So if I move off to my left and I feel restricted to the right hand side next to my spine, that's a good example perhaps that we've got some quadratus lumborum issues happening there. And that's a muscle that we find to be very problematic in the general population, it's fair to say. It also has this secondary role, which is something that I'm going to come on to talk to about, as a core stabilizer. So we're going to talk about core stability in a bit more detail shortly. But actually, what the quadratus lumborum does is it assists in core stability work. Now, it's important to say that it's a secondary stabilizer. It's not its primary function. So if we're not strong enough in our core, then what can happen is these secondary stabilizers do too much work and we develop dysfunction in this muscle, and that's why it can become problematic. So as I said, it attaches to the pelvis, to the lowest rib, but also interestingly and importantly, it also has attachment points onto the spinal vertebrae of the lower back. So I've mentioned core stability. Now, this is a buzz term. I'm sure it's one that we're all familiar with. Core stability. What is core stability? Well, core stability is broken down, if you think about it, the fact that muscles can do two things. They can mobilize, they can create movement, or they can stabilize, they can protect a joint. Now, there are certain muscles, as I just mentioned in the case of quadratus lumborum, that have a dual function that do both things. But we also have muscles that really their primary focus is to stabilize a joint. And when it comes to core stability, these are the muscles that are looking to stabilize our core or our lower spine. So we term these the core stabilizers. Now, our main core stabilizers are muscles such as our transverse abdominis, can sometimes be called TVA, or our multifidus. Now, in the case of the transverse abdominis, this muscle, we think of it like a corset. But the thing is, again, I think a lot of people, when it comes to thinking about core stability, think of their stomach muscles or the classic sort of six-pack muscles, when actually it's muscles that sit deeper than those. So you can see here with this image that we've ripped away these stomach muscles to reveal this muscle underneath, which is the transverse abdominis. Okay, and this is like a corset wrapping around our spine, where its role is to really protect that spine. So it therefore makes sense that in order to help with the back, to give the back stability, to give it strength, to prevent it from injury, by working these core stabilizers, that can be a helpful thing for us. But what's important to understand is what those core stabilizers really are. So when we're doing good core stability work, we should be feeling the pull really deep to our stomach muscles. That's sort of almost like the center core of our body should be working to make sure we're recruiting those muscles. And typically speaking, it should often be under quite a low load as well, an exercise that you can maintain. Because when we're working stability muscles, what we're looking to do is not do too much movement, but form a stable exercise. So if we think of something like the plank, there's actually not any movement really going on at all there. But what you're doing is working those core stabilizer muscles to protect the spine. So that's why we use that exercise to work the core. Although we would always say that in our opinion, particularly if we're just beginning a core stability workout, there are better exercises than the plank, because the plank can be very difficult to do well. But we know that improving our core stability will help our overall performance from a sporting point of view, but will help to reduce any back pain or back problems that we have. And then the glutes. Now, again, if you know me or have heard me speak before and things, you know that I often talk about the glutes because they are our biggest, our most powerful muscle. They're fantastic, absolutely vital for us, but they can create a lot of dysfunction. And again, as we can see from this image, the fibers of the big glute muscles come up and run into our lower back. So again, I have this phrase that I often use that is, your back hurts, but it's your butt's fault. So what we're finding is, yes, you've got back pain, yes, you're feeling sore in your lower back, but actually a lot of the cause or a lot of the dysfunction is coming from those glute muscles, or your butt muscles, for want of a better term. And as a result, I call these the big bullies. They're powerful muscles, but they beat up other areas. So it's always worth, if we are having lower back issues in particular, to be investigating those glutes, looking at their flexibility, looking at their strength. So as I said, we find these to be problematic. Tightness in the glutes is a common cause. So something you want to be doing straight away is stretching out those glutes, assessing the flexibility of the glutes. But we also find that they can be underactive. So what I mean by that is, they're our biggest, most powerful muscles. So they have the ability, and we want them to do the most work. But if we don't recruit those muscles correctly, then other muscles have to do the work of the glutes. And that results in dysfunction that can then affect the back as a result. So we also want to make sure that they're working correctly. And that's why the glutes are very, very important for really anything that we do, but particularly in solving. We be helping you. Well, what we would say is that if you have found any of these symptoms be resonating to you, or you want deeper investigation for your back, what we would encourage you to do is to reach out to us. Feel free to ask any questions, comment on this video, and we'll make sure that we come back to you. Let us know if any of these are things that you've experienced. But if you would like to get some deeper investigation and truly understand what's going on with your back and making that as strong as it can be, then reach out to us. You can find all our information at our website as ever, or via whichever means that you're watching this video. And we would look forward to working with you and giving you a better understanding and resolving your back pain to allow you to be achieving the goals and the things that you want to be achieving. Thank you for your time in this webinar. I hope that you found it helpful, and I look forward to speaking to you further soon.